name is Cheyenne, and my project is called Empowerment Through Data, Steps Towards the Redevelopment of a Community Health Profile for Island Health. So to start off, a bit about me. That's a photo of me in the middle. I grew up in Squamish, BC, which is the unceded territory of the Squamish Nation. And I currently live and completed my practicum in Victoria, which is the unceded territory of the Kwangin, Wasanich, and Esquimalt people. And then the other photos on this slide are of important people in my life, and I thought it was important to acknowledge these people before I got started because they've all played a really integral role in supporting me while I've been doing this program. So I completed my practicum with Island Health's Population Health Assessment, Surveillance, and Epidemiology team, supervised by Marisha Gully. And as you can imagine, working in this department got really interesting over the several months I was there. I've included a photo I took right around the time they announced they were closing Canada's borders to try and slow the transmission of COVID-19. And at this point, things were really starting to escalate. So during my practicum, I was tasked with conducting research that could potentially inform the redevelopment of Island Health's LHA profiles, which are essentially community health profiles, and I'll explain more about them later. So community health profiles are as a whole are a really popular topic right now in the public health realm. And there are a lot of cooks in the kitchen trying to develop something original and useful, but until some progress is made on that, Island Health wants to look at how they can make what is currently available stronger. So what is a community health profile? Well, it's a snapshot of the background health information of a population. And community health profiles serve to identify how a community is being impacted by various determinants of health. So my project can be broken down into 3 steps: the review and assessment of existing profiles, creating a survey on the most useful community health profile indicators, and researching an ideal community health profile framework. So starting with step 1, I wanted to look at the kind of health profiles currently available in BC. As a baseline, I took an in-depth look at the Island Health LHA profiles. And then my supervisor wanted me to compare and contrast them to the profiles generated by the Provincial Health Services Authority and the Ministry of Health. So starting with Island Health's LHA profiles, so local health areas, or LHAs, are geographic areas defined by the Ministry of Health. And as you can see on the map on this slide, the Island Health region consists of 14 LHAs. So each LHA profile contains information about a population's health status and the ability to access health services. So these profiles are publicly available on Island Health's website. And the main issue with these profiles, and really any profile that uses the LHA boundaries, is that LHAs are large geographic regions, and Island Health has been receiving feedback from members of various communities within the region stating the profiles cover too large of an area, making the data contained within not necessarily relevant to individual communities. And it's this kind of feedback that started us down this road in the first place, asking how can we create something that accurately represents the health of a community in a way they will find useful using the resources we already have. So next, I looked at the Ministry of Health LHA profiles. They use the same geographic boundaries as Island Health's profiles, and their stated purpose is to provide a simple language, user-friendly, and high-level overview of the population. And these profiles put a lot of emphasis on health service access and use. Finally, I looked at the profiles generated by the Public Health Service Authority. Starting in 2014, PHSA started releasing the BC Community Health Profiles for each incorporated municipality in British Columbia, and they release these annually. And these profiles are currently available as an interactive web tool through PHSA's website. And these profiles are the most similar to Island Health's LHA profiles content-wise. So I wanted to figure out what these 3 profiles had in common and where they were different. And I'm a very visual learner, so I decided creating Venn diagrams for this would be helpful. So I created 4 Venn diagrams, each representing an indicator grouping broken into demographics, determinants of health, health status, and health service use. And in the interest of time, I'll only talk about 3 in this presentation. But in terms of demographics, all three profiles had very little in common in how they reported demographic information. The only indicators all three profiles reported are total population and population projection. And then as for determinants of health, all three profiles include indicators relating to income, housing, education, and employment, but that's really all they had in common. And then in terms of health service use, this diagram really illustrates how different community health profiles can be, even though they have a common goal. As you can see here, the Ministry of Health puts a lot of emphasis on health service use in their reporting, whereas the other profiles barely touch on this, if at all. So all three profiles aim to serve the same purpose, to give an overview of the factors impacting the health of a population. And they all do this in slightly different ways using several different indicators. So for the second step of my project, I created a survey to determine what factors of each of the profiles are of the most use to stakeholders. And the survey presents all the indicators referenced in each of the three profiles and asks respondents to select the ones they find the most useful. And then there's also an option for respondents to add their own ideas of what they would find useful. And unfortunately, this is as far as we got with this survey. With COVID-19, priorities understandably shifted. But once things have gone back to normal, these surveys will be distributed to internal island health stakeholders. And this will include medical health officers and public health and planning staff. And then best case scenario, a second round survey distribution will focus more on community stakeholders, including municipalities, school districts, community groups, and individual community members. So for the final step of this project, I was tasked with finding a framework into which the data collected from the surveys could be populated. And for this, I had a couple criteria the framework had to meet. It had to work with the data already available to us, since primary data collection at this point in time is not an option. And it was important to Island Health's medical health officers that the framework incorporated health equity, as this is something severely lacking in what is currently out there. So this was harder than you'd think. I ended up finding two frameworks, one for the overarching structure and one for the selection of domains and indicators that I recommend be combined. Health equity-wise, I found a lot of literature stating there weren't any good examples of community health reporting frameworks that efficiently incorporated health equity. I did find, however, a proposed framework that incorporated health equity, and it was developed by the National Collaborating Center for Public Health. And in this proposal, they outline a set of guiding questions for each step of the framework, all aimed at maintaining a health equity lens. So with an overarching framework in place, domains and indicators to fill it in must be selected. Again, Island Health is currently restricted to the data that is already publicly available. So I needed to find a set of domains and indicators that would work with what we have and what we'll find out from the survey, but will also facilitate the health equity lens being set up by the NCCPH Act framework. So PHSA released a literature scan in March 2013, all about choosing appropriate health indicators. And in this paper, several reporting frameworks were analyzed. So the PHSA concluded that the Canadian Health Indicator Framework would be the best at presenting the domains and indicators with a health equity approach, while also being the most adaptable to BC. And the indicators included in this framework are listed on this slide. So now I had to determine if the data available to us would work in this framework, and I did this by building diagrams again. So the figure on the left shows the non-medical determinants of health indicators, and as you'll notice, there is a lack of indicators for environmental factors, and this is obviously a substantial gap that would need to be addressed. The figure on the right shows health status indicators. Again, there's a gap this time with the human function domain. Fortunately, Statistics Canada collects data on this, so it wouldn't be too hard to incorporate. I didn't end up building diagrams for community health and system characteristics or health system performance. Community and health system characteristics is an important domain within which indicators should be identified for a community health profile, but none of the profiles I assessed adequately covered this domain. And this is obviously a huge gap that could be an entire project in and of itself. In terms of health system performance, this particular domain falls outside the jurisdiction of public health, so less emphasis is needed on this subject in a community health profile. So what's next? Well, my project covered the first three steps of this list that I introduced at the start of the presentation, but there's still a lot to do. The survey I created will have to be distributed so data on what kinds of indicators are of the most use to CHP users can be collected. Next, these results will have to be compared to the indicators outlined in the Canadian Health Indicator Framework to ensure each is adequately represented. And during this, it's important the steps of the NCCPH Action Framework are being employed to ensure the health equity lens is being considered and upheld. And then finally, a template or some sort of underlying structure into which all of this data can be populated will have to be created. So overall, not a small undertaking. On a smaller scale, this project was intended to help begin the process of redeveloping Island Health's LHA profiles. But on a broader scale, the aim is to incite and inform discussions around the streamlining of community health profiles in British Columbia. And I hope Island Health finds the work I did here a helpful starting point. So that's the end of my presentation. I'd like to thank my supervisor, Marisha, along with the rest of Island Health's phase team. They made me feel really welcome during my practicum and were super great at facilitating learning opportunities for me, even when things started getting really crazy. I'd also like to thank Victoria for being such a huge supporter. I really admire both your and Nigel's commitment to ensuring everything stayed on the rails for us these last couple months. So with that, are there any questions?
Thank you very much. I'm just blown away by how great the presentations have been, yesterday and today. So great presentation. So are there any questions from our audience? Brittany, please go ahead.
Hi, Cheyenne. Great presentation visually. So one of the questions I had, I guess, what were the biggest limitations structure-wise for the profiles?
Yeah, that's really interesting. I think the most obvious answer is the fact that these profiles are being generated using one template. So each profile contains the same domains and indicators, and they don't really take into consideration the unique needs of a community. And I mean, this is obviously done because it's cost effective and it's easy to just click a button and fill in a template with location-specific information. But this goes back to the community feedback of these profiles not necessarily being what is needed. And it's this notion of a one-size-fits-all approach that we find ourselves often battling in public health. And unfortunately, with the lack of resources available for this right now, addressing it's going to be hard. But given the opportunity, it's something that I'd really like to look more into.
Excellent, thank you. And there's time for one more question. Jeff, please go ahead.
Hey, Cheyenne, it's Jeff here. Really great, interesting presentation. Thank you. Just a couple of quick questions or comments, I guess, around, did you get to a kind of in terms of the intended mandates or objectives of these three different profiles, whether they were different? It was really interesting to see the similarities in your diagrams, helped really clarify what covered what, but were there clear intentions of what each one was trying to accomplish? And then just a question about the survey, are you going to look at use of them? So ask if what practitioners, are they using one or a combination or both? Because it certainly seems like you've identified a lot of overlap and a lot of opportunity for efficiency of providing data. So thanks.
Yeah, so your first question was, sorry, it was around...
Oh, sorry, just if, were there clear, if, was it easy to, did they have an intended objective that was different from one another, or were they all just very general, or talking about the profiles and didn't really go?
Yeah, so they all had very similar objectives in that they wanted to just kind of summarize the health status of a community. That was broadly, that was kind of all their objectives. And they're all kind of targeted towards the general public. So they're meant to be as accessible as possible. But I think that was kind of, they all had their shared common goal. And then your second question, sorry, that was around?
Whether your survey was going to ask around usage of the various tools. So if it might be telling if 3% of the people are using the PHSA tool, is it even needed?
Yeah. So that's definitely something that we want to incorporate into the surveys. We're still at this, by the time I completed my practicum. We're still at the stage of kind of developing and getting feedback on the surveys. And we were kind of talking about how we wanted to target the people that would fill them out. And so we wanted to mainly target the people that are using the LHA health profiles that Island Health generates, just because they're going to be the main users of this new one. And we were trying to figure out how we would figure out exactly who is using them the most. And so there was some talks about maybe monitoring website traffic to actually kind of see how many people are accessing them and where they're accessing them from. So that would be an interesting thing to also add to the survey. So thanks.
Gotcha. Great job.